Hi, I'm Dr. Lisa. Cerebral palsy is a condition that affects the ability of a person to move and to coordinate movements. It's often suspected if a child is not reaching the milestones of childhood in a typically smooth fashion, or when the limbs are moved, if there's an unusual feeling to those limbs, a stiffness or a very low tone feeling, then cerebral palsy may be suspected. It is caused by an injury to the brain when it is very, very young. In medicine, we call this an immature brain, and the most common cause actually is unknown. It is most commonly caused by something that happens during development that injures the brain, and the baby is born with this condition. In some cases, there may be problems around the delivery that can cause cerebral palsy, though that's far more rare. And then after delivery, up until the age of 3, if a child develops a brain injury of some kind, either from a near drowning or a fall, or if the child is abused and sustains a brain injury, that child would be said to have cerebral palsy if they are left with a problem with movement. Now, cerebral palsy is named in two ways. One is for the tone abnormality that's caused, and the other is for the limb distribution. And let's talk about both of those. So tone abnormality means that when the limb is moved, a limb feels a certain way. So if I move your arm, there's a typical way it feels, and physicians know what that typical is. In children with cerebral palsy, there can be a condition called spasticity. So when the limb is moved, the faster it's moved, the stiffer it gets. There are many other tone abnormalities as well. Dystonia, athetosis, dyskinesia, hypotonia. So a physician would accurately be able to determine which tone abnormality a particular child has. It's also named for the limbs that are affected. So we call that the distribution of the cerebral palsy. A child that has 2 limbs involved is said to have diplegic cerebral palsy. One side of the body, upper and lower limb, is hemiplegic cerebral palsy. If all 4 limbs are involved, the child is said to have quadriplegic cerebral palsy. Usually we will name the tone abnormality and the limb distribution. So we might say a child has spastic diplegia, for example. Now, there are things that are often seen in association with cerebral palsy, but not in all children. So saying someone has cerebral palsy does not necessarily mean that they have an intellectual disability or a problem with speech or that they use a wheelchair. Many children with cerebral palsy have those problems, but certainly not all. And so the term CP or cerebral palsy only means that there is a disorder of movement and tone. The other issues that track with cerebral palsy need to be watched for and need to be followed by a qualified physician so that those things can be addressed if they are a problem for that particular child. If a person thinks that their child might have cerebral palsy, they should go to their pediatrician and ask for a referral to a specialist. Perhaps someone like me. I'm a physical medicine and rehabilitation doctor, also known as a physiatrist, but I just say I'm a kids rehab doc because that seems to let people know what I do. A neurologist might also be able to assist with diagnosis, as well as a developmental pediatrician. Depends on who's in your area, but usually a specialist is involved in making the diagnosis, and there may be some additional testing that's needed to confirm the diagnosis. The important thing for parents to know is that cerebral palsy can be optimally managed, and children can show wonderful dramatic improvements with the proper interventions over time. It is a lifelong condition, but it can be well managed. Children can show great improvements. Children can lead optimal lives with cerebral palsy. And that's really what every parent wants.